Hi everyone, my name is Issa Peterson and I am the Hunger Advocacy Fellow as she mentioned. And today I really have the pleasure of introducing our first speaker of the day, and she's actually coming quite a distance to see us, so it's a really great treat for us. She is Cara Cook. She's the Director of Programs for the Alliance of Nurses for Healthy Environments. In her role, she really tries to lead the organization in environmental health programming to engage nurse organizations. Oh, not loud enough? Sorry, I'm a little too tall. But yeah, so she tries to engage nursing organizations, and the profession in advancing both health advocacy, education, and practice change globally. We were actually fortunate enough to meet her in Scotland. I think the president of our foundation, Beeman Floyd, met her during a meeting with Nancy Pelosi, and so we were actually very fortunate to get her to come here and really talk about public health and climate and how they intersect. So will you help me in welcoming Cara Cook to the stage?
Hi everyone, good afternoon. Can you all hear me okay? Perfect. Now let's see. Does this work too? Can you use this? Oh, I have to do this way? Oh, I see. I haven't been out in a while, so gotta relearn everything. So it's so great to be here with you all. Thank you so much for inviting me. Thanks to those who are joining online. Like Issa said, I am Cara Cook. I'm the Director of Programs for the Alliance of Nurses for Healthy Environments. I am also a public health nurse by background. And I'm so pleased to be here with you all to talk a little bit about the intersection of human health and climate change. And I know you're going to get, I think this is like Climate Day here, because you're going to get a couple presentations on climate change. And I'm hoping that I can bring a different perspective in sharing how climate change is really a public health issue. And the reason that we like to think about this as a public health issue, not only does it impact health, but it's also a different way to, it's also a different way to shift the conversation and really get people understanding how climate change impacts their day-to-day lives, and helping to shift the discussion in how we talk about climate solutions. So just a quick introduction to the organization that I work for. So the Alliance of Nurses for Healthy Environments, we're actually a national nursing organization. We work with many nurses in Texas as well as across the country. And we focus solely on the intersection of human health and the environment. And we partner with a number of health-related organizations, nursing organizations, as well as many organizations like you all. And so just jumping in real quick, I'm not going to do a really deep dive into climate and health impacts. I want to talk about it more specific to Texas and what is applicable to you all living in the state. But this graphic from the Centers of Disease Control really gives kind of a high-level overview of how we are seeing climate change impacting human health. And so on this inner circle here, you'll see the environmental changes or the climate-related impacts, such as rising temperatures, elevated sea level rise, more extreme weather. And then when you go to that second layer, you see how that translates into exposures for people. And then the outer layer is what we're actually seeing in terms of health outcomes as a result of those exposures and climate-related impacts. And so when we look specific at Texas, sorry, some of these things aren't coming up, but that's okay, I'll tell you. This is supposed to be extreme heat and health. And so when we look specifically at Texas, we see extreme heat becomes a major issue for the state. As you may know, Texas is experiencing many more extreme heat days. And Texas is actually home to 9 of the hottest cities in the US. And currently averages more than 60 dangerous heat days a year. And by 2050, that's projected to increase to 115 days per year. And that's second only to Florida, so that's pretty significant. And when we look at what that translates into in health outcomes, we actually see that a little over 800,000 people are extremely vulnerable to the health impacts from extreme heat exposure. And when I say extremely vulnerable, what I'm referring to here specifically is younger children, so those under 5, the elderly, and those who are living with lower incomes. And I'll go a little bit into more depth about other populations that are impacted by extreme heat, but I want to talk a little bit about how this translates into health outcomes. So our bodies aren't really effective at cooling down during heat waves, especially if it's humid out. And the longer our bodies remain overheated, the greater the risk of heat-related illness is, and it can even result in death. So higher body temperatures are associated with increased heart and respiratory rates, as well as increased risk of heart attacks. Oops, sorry. There we go, I'll put that down. As well as increased rates of heart attacks and respiratory exacerbations of chronic conditions like asthma or chronic obstructive pulmonary disorder. We also see that pregnant women are an elevated risk due to the hormonal changes in their body and the difficulty in their ability to regulate their body temperatures. We also see poor pregnancy outcomes which are associated with heat exposure, such as preterm birth, low birth weight, and stillbirth. And as I mentioned, both the very young and the very old have difficulties in keeping cool during extreme heat events. Low-income elderly especially, maybe especially susceptible to extreme heat, and it could be because they don't have air conditioning or maybe can't open their windows, or perhaps they're homebound and can't go to a cooling center if they need to cool down during extreme heat events. We also see occupational health risks, so those who work outdoors like construction workers, agricultural workers are going to be at an elevated risk. In addition to just overall extreme heat exposure, we see a correlation between elevated heat and poor air quality. And so what happens on warmer days is we actually see increases in ground level ozone pollution, which has a number of documented health effects which include respiratory exacerbations, again, your increases in cardiovascular conditions like heart attacks or strokes. And then you also see risk of premature death. And then this is talking about specifically extreme weather events, which is, I know, a very big issue, a climate risk for this state. And so when we look about across the specific extreme weather event risk, we know extreme rainfall is a really big deal, as it can result in increases in flooding, which can result in destruction of property, people having to evacuate from their homes. We also see, because of sea level rise, we see the risk of more intense hurricanes, as well as more intense storm surges, which threaten people's health, as well as their homes and livelihoods. And we're also seeing areas such as in East Texas that are at increased risk of wildfires, which has implications for human health as well. And what we're seeing is that low-income communities and some communities of color are really bearing the burden of health impacts as it relates to these climate-related risks. Healthcare institutions are also at an elevated risk, and I'm going to talk about this a little bit further in my presentation, but that creates unique risks for a community as we see disruptions in healthcare delivery and services, which exacerbates the health impacts that a community experiences. For example, we saw when Hurricane Sandy hit New York, many of the hospitals and healthcare facilities, their power, the backup generators were in the basement, and those instantly flooded. And so you saw healthcare providers having to evacuate some critically ill patients during that time, which can be incredibly dangerous to be doing, especially for critically ill patients. We also know that increasing droughts and higher temperatures are likely to interfere with agriculture in the state, which not only threatens food production in the state, but also threatens people's livelihoods. And we also know that drought can impact crop yields and lead to less nutritional content of our food, which creates impacts. We're not only seeing impacts to water supply, we're also seeing impacts to our food supply. And I mentioned a little bit about this, but just as with other environmental risk, we see that climate change doesn't impact everyone equally. We see vulnerabilities, whether that be relating to someone's age, different physiological effects at different ages, or whether that's because of an increased exposure. And so specifically looking at impacts across life stages, I mentioned the impacts that pregnant people experience. They're at an increased risk of health impacts relating to climate change. We also see that the elderly as well as the young are very susceptible to climate risk. And then this is talking a little bit more about what happens when people who perhaps don't have the ability to respond as well because of resources or location or whatnot, and how that can translate into an elevated risk. And so this is showing that maybe people have the same level of exposure to a climate-related risk, but then when you add in whether there's specific sensitivity, whether that be because of their age or because they perhaps are living in poverty or for whatever reason, that how that might translate into that being at an increased risk of health impacts and therefore more likely to have adverse health outcomes. And so we look at this as health risk can be really seen as a combination of exposure to climate hazards, sensitivity to those hazards, and then whether someone has the adaptive capacity or an ability to respond to those hazards. So just as an example, if there is an area that's hit by a hurricane and you have low-income residents who aren't able to evacuate, therefore they're at a higher risk of harm than those who are able to. And so this is important to think about because we need to be able to assess people's health risk in order to be able to allocate adequate resources to be able to protect them in the event of these extreme weather events or climate-related impact. And then I want to shift a little bit to talking about some of the root causes of climate change. And I know you have some more detailed presentations later on methane and climate change, as well as the Texas grid, but I just want to talk a little bit about some of these things from a health standpoint. And so when we look at some of these root causes of climate change, they also have health impacts in themselves. So, for example, we know fossil fuels are a major driver of climate change. And throughout the whole life cycle of fossil fuels, as well as other non-renewable energy sources, we see significant impacts to air, land, and water, and with that, human health. Burning fossil fuels not only contributes to climate change, but it actually emits a number of pollutants that are harmful to both the environment and public health. And these can lead to premature death, heart attacks, exacerbation of respiratory conditions. And we also see impacts on absenteeism at school and work. So perhaps a child has to miss school because of an asthma exacerbation, or a parent has to take off of work because they have to care for their sick child or a sick family member. And we're also seeing some connections between burning fossil fuels and a link to autism spectrum disorder and Alzheimer's disease, although these are not as well established as some of the other health impacts that we know are related to fossil fuel use. And then I know the oil and gas industry is very big in Texas, so I did want to mention a little bit about some of the health impacts that are associated with oil and gas in the state. And overall in the US, more than 12 million people live within a half a mile of an oil or gas well. And we see health impacts that result from whether it be the air or water pollution, but it also can be waste from the operations, or it can be from noise or light pollution that just is a result of oil and gas operating continuously. And Texas is a top producer of natural gas, and it's also a state that relies significantly on natural gas. So this is, when we think about health impacts, this is a really big deal for people living in the state. And 2.3 million Texans actually live within a half a mile of an active oil and gas operations. And we know that the health risks are more for people who are living closer to these facilities. And so this is just talking a little bit about some of the health risks in Texas relating to oil and gas. So in addition to methane, which you'll hear more about, methane is a potent greenhouse gas. Oil and gas operations also release toxic air pollutants such as benzene, which is a cancer-causing pollutant. We also see these pollutants that contribute to ground level ozone, which I mentioned previously is linked to worsening cardiac as well as respiratory conditions. And so the figure on the left is looking specifically at cancer risk per Texas counties. And so exposure to these toxics was found to raise the cancer risk above EPA's level of concern in 82 Texas counties. And children, as I mentioned before, are especially vulnerable to this pollution. Over 900 schools in Texas are located within a half a mile of oil and gas operations. So that's pretty significant when we think about vulnerability to this kind of health risk. And the figure on the right is showing asthma attacks attributed to oil and gas air pollution. We see nearly 140,000 asthma attacks per year attributed to ozone pollution from the oil and gas industry. And you can see which counties are most at risk from the chart here. And so this kind of helps us identify specifically when we talk about who is most impacted by oil and gas in the state, we can see where we're seeing the biggest risk. I also want to talk a little bit about fracking. What fracking is, or hydraulic fracturing. We've been seeing due to changes in technology, fracking has become way more widespread. And this, for those of you who don't know what fracking is, this is a technique which allows for the extraction of natural gas or oil from shale or other rock formations. So what actually happens is large quantities of water and chemicals and sand are blasted into these formations at high pressure, which creates cracks in the rock formation, which allows the natural gas to release and come back up to the surface. But there is a growing body of evidence that shows that fracking cannot be done safely and creates significant health risks. Fracking in itself uses a massive amount of water, so you have impacts to water supply. And what happens with this water is a bunch of chemicals are added to it, and so you have a lot of wasted water. And then you have a lot of potential for water contamination because you have water that's contaminated with chemicals that can seep into groundwater sources. Fracking sites also release a ton of air pollution, including chemicals that can have immediate impacts like giving people headaches, asthma attacks, or it can have more long-term impacts such as exacerbating cardiac problems or contributing to birth defects. Many of the chemicals in fracking all of them aren't known, but what we do know is of the 100+ chemicals that have been identified, there's a number that are harmful to human health, and some are even known to cause cancer. And so I mention this because in Texas you have the Permian Basin and the Eagle Ford Shale, which studies have actually linked in these areas increased levels of harmful chemicals in water near fracking sites, which is particularly concerning for people who are living in those areas. There's also concern that state regulation may be only loosely enforcing, which increases risk to health, because we know we haven't seen any proof to show that fracking can be done safely, so the regulations that are in place should be strongly enforced to really ensure that we're reducing risk to health. And then I want to shift to talking about how climate change intersects with health disparities, as well as talking about how lack of preparedness and resiliency planning can exacerbate health disparities. And so I'm going to use the example of the winter storm that happened in 2021. And we really saw how the lack of preparedness from the Public Utility Commission created unnecessary health impacts for people in the state. And I know there's an opportunity coming up for you all to kind of weigh in and provide input to the state agencies about the failures that have occurred. And so I think having public health be a component of this conversation is going to be really important, because we know that clean water, access to power is all essential to our health, and state agencies are really failing to protect the health of people living in Texas, and this is just one example of something that has shown that. So this information comes from a report pulled together by the Hobby School of Public Affairs at the University of Houston. They conducted a survey about 15,000 residents in Texas, and what the results showed is that more than 2 out of 3 Texans lost electrical power at some point during the storm. And this was for an average total of 42 hours, during which they were without power for one single block, an average of 31 hours. And so this is in contrast to what normally happens for when there's low energy supply. Typically there'll be rotating blackouts, short periods of blackouts, and that's a bit easier to manage in terms of thinking about health risks than it is to manage someone being out of power for a long period of time. We also saw that almost half of Texans lost access to running power during this week period, with the average Texan not having running water for 52 hours. Other negative effects that we saw from the storm included difficulty obtaining food or groceries, loss of internet services, and difficulty obtaining bottled water. And the survey also found that 3 out of 4 Texans did not believe that the power outages in their area were carried out in an equitable manner. This chart is actually showing the loss of power and water by race and ethnicity. And so when we look at loss of electricity, which is on the left-hand side, you can see there is significant disparities by race in terms of who lost power. When we look at those without running water, we do see similar distributions across race and ethnicity. And there were a number of public health implications that were experienced as a result of the winter storm. These included, typical impacts that you would think about from cold weather exposure, like hypothermia, but we also saw a rise in carbon monoxide poisoning because people had to look for alternate ways to heat themselves. They became desperate, and so they were using gas ovens or cooktops, propane heaters, outdoor smokers, stuff that isn't very safe to be operating as a source of heat. And so that contributed to the increase in carbon monoxide poisoning. We also saw that for those who rely on electricity for their medical treatments, such as if someone has asthma and maybe needs nebulizer treatments, or if someone is diabetic, they need their insulin refrigerated, this loss of power can be life-threatening to someone who relies on electricity for medical therapy. There was also concerns relating to contaminated water and water shortages, which we know can lead to waterborne illness. And then during this event, we also saw a disruption in healthcare services, which I'm going to mention a little bit later in the presentation, but that can be really detrimental to people. And the mental health impacts that arise after these events are taxing, whether that be losing a loved one, having high expenses from increased utility bills or destructions of homes and having to be able to rebuild, or just the overall trauma and stress that results as living through an event like this is very traumatic. We also know the storm was life-threatening, and this is looking at a breakdown of the causes of death, which we see the number one cause at 161 fatalities was from extreme cold exposure. And then the second leading cause was 25 deaths relating to those who had chronic conditions that were exacerbated by the storm conditions. We also saw counties reported dozens of deaths from house fires, carbon monoxide poisoning, as well as other causes. And this isn't unique just to the winter storm. A study that was conducted in 2018 showed that cold weather generally increases health risk significantly in Texas, ranging from 0.1% to 5% for mortality and 0.1 to 3.8% for emergency hospital admissions, which is 1 degree Celsius decrease in temperature below cold temperatures. And the cold effects vary by age groups, with the highest risk being in people over 75. And I want you to just think back to that slide I presented in the beginning, which looks at how risk changes depending on exposure to climate hazards, the sensitivity to those hazards, and the adaptive capacity to be able to respond to those hazards. And so for this section, I'm just going to talk a little bit about how energy security, disruption in healthcare services, and the pandemic have really exacerbated climate-related impacts. And so when we look specifically at energy insecurity, we see that the main determinants of whether someone is energy secure or not is their race, income, gender, as well as their health status. Energy security is linked to food insecurity, housing insecurity, institutional racism, income inequality, and then with that, public health disparities. And we can just see how things start to kind of overlap in terms of someone's capacity to respond during an climate-related event. Low-income energy consumers spend a disproportionate amount of household income on energy. If we look specifically at Texas, the average energy burden of low-income households is 9% compared to 2% for non-low-income households. And prior to the pandemic, we saw 30 to 55% of low-income households had trouble paying their electric bills, and they have to make some serious trade-offs. If they want to pay their electric bill, they want to get food, they want to pay for medical care. It's trade-off one after the other to be able to afford their electricity bills. And the pandemic has only exacerbated this issue. And so, like I was saying, you see these burdens start to overlap. So the pandemic, climate-related impacts and exposures, and then if someone is energy insecure, that is only going to exacerbate that. Climate change not only impacts health, but it impacts healthcare delivery. The healthcare sector, just like many other sectors, suffers billions in losses as a result of increased disease and injury, or losses because they have to shut down their operations during a climate-related event. In addition, hospitals and healthcare workers are caring for those most impacted by climate change, and therefore it's critical that access to healthcare is maintained so that people can receive treatments and emergency care during extreme weather events. But the issue is that many hospitals and healthcare facilities aren't prepared for this increase in climate-related events, which causes major concerns when we think about the number of climate-related events that are going to be happening as climate change worsens. Give me 1 second here. Sorry about that. So this graphic is showing how a lack of preparedness during climate-related events can really contribute to healthcare impacts as well as disruptions in critical community services. And this is looking at specifically at severe storms, flooding, temperatures, and wildfires. So if we just take the example of wildfires, we know wildfires lead to poor air quality and population displacement, which results in mental health impacts, asthma exacerbations, people having to leave their homes. And then when we look at how, in terms of a healthcare sector's ability to respond, we see that if many hospitals, if they're in the path of a wildfire, maybe have to shut down their operations and evacuate patients. They also have staff members who maybe their homes are in the path of the wildfire, and you can see how this kind of, how the severe storms or the climate-related impacts, how those all kind of trickle down and have implications for the healthcare sector. But when we look at the benefits of preparing, we can see that effective risk management and upfront investments in mitigation and climate resiliency really make a huge difference and enable healthcare systems to be able to stay operational during extreme weather events so that they can care for people who are requiring services. And so this slide is just using the example of Texas Medical Center to talk about how hospital preparedness really makes a difference, a big difference. So during Hurricane Allison, there was significant damage to Texas Medical Center's emergency generators and their electrical switchgear, which caused a complete power outage. Staff had to work by flashlight. They had to ventilate patients by hand, which is extremely dangerous to be doing. And they had to evacuate more than 1,000 patients from TMC hospital rooms and intensive care units. But what we saw after the storm is that the medical center actually invested more than $50 million to upgrade their infrastructure with more resilient infrastructure and more sustainable design features. So that in 2017, when Hurricane Harvey hit, all the hospitals within the Texas medical system were able to stay open and their emergency rooms stayed operational. And so that may seem like a significant investment up front, but when you calculate how much a hospital loses from having to shut down during an extreme weather event, that's really not much at all, and it makes a huge difference. And then looking specifically at the winter storm, just as an to exemplify this, we saw a number of disruptions in care because of the storm. So in preparation, many hospitals will discharge as many patients as they can as possible who don't need to be in the hospital, just to not stress their beds, since they're likely going to see more people come in. What we saw during the storm is that many hospitals had issues with maintaining power and struggled with a lack of water supply. Hospitals were unable to flush toilets and had to rely on other methods to dispose of human waste. We also saw, because of the loss of water in the community, many of the dialysis centers had to close. And so people who normally, and this is dialysis, typically people receive this 2 to 3 times a week, and it's something that people can't go without if they have a condition that requires it. And so we saw people having to use hospitals for their dialysis care. But what happens is a hospital has to be able to deliver that care and have the adequate water supply to do so. But what we saw is that even if people were coming to the emergency room, if the hospital wasn't able to give dialysis care, they had to transfer people to other facilities. And hospitals also reported that even if there was water flow, the water pressures were not high enough, and therefore they were under, either it wasn't functioning well enough or they were under boil water advisories. And this not only affects drinking water, but it can affect laboratory functions as well as sterilizers that are used to sterilize surgical equipment. So it really impacts many aspects of the healthcare system. We saw hospitals having to ship in water from other facilities, but what ended up happening is that there was issues getting to the facilities because of the travel impacts. And so that was a big issue in terms of hospitals maintaining water supply. And it's not a big deal when it's one hospital that has issues, but in these extreme weather events, many hospitals can have issues. And so when you have many healthcare systems experiencing similar issues, it's really hard to mitigate the community risk and be able to get people the treatment that they need. And so what happened is, in addition to all that hospitals were already struggling with, we see an influx of patients into emergency rooms during this time, whether that be for those who lost power and have, maybe they're on oxygen or they have electricity dependent needs, like they have a home ventilator that they need. They absolutely need access to power 100% of the time. And so they had to come into the hospital to receive their care. And those people cannot be discharged home because they do not have the supplies at home and it's not safe for them to go home. And like I mentioned, some of those other issues in the beginning is that hospitals saw patients with carbon monoxide poisoning, those requiring treatment for hypothermia. And what happens is this influx of patients beyond the normal ED levels can really tax healthcare systems, especially if when we're dealing with things like a pandemic and they're already being taxed. Facilities are already being taxed. And there is also one article that mentioned about a health system which has more healthcare facilities than just in Texas. But what they were mentioning is that they actually didn't realize that Texas operated on a completely isolated power grid and that people would be out of power for long periods of time. And so what happened is that they were anticipating that they would have rolling powering outages, but because that helps reduce health impacts, but people are out of power for so long that this has to be managed in hospitals because people need access to power for certain things. And then COVID-19 has also exacerbated climate risk. And so we saw this during the winter storm, as well as many of the other extreme weather events that have happened during the pandemic. And this chart is just looking at how the pandemic has exacerbated climate hazards and risk. We know that if people are socially distanced, we can prevent the spread of the virus. But what happens is during extreme weather events, people may have to leave their homes. Maybe they're going to stay with family or friends, or they're going to a shelter. And this is, putting them in contact with people and potentially enabling the spread of COVID. And as I mentioned, hospitals and healthcare systems were already stretched thin during the pandemic. And so when you add on an additional extreme weather event, you have situations where delivery of care is threatened because of power outages or lack of water. But then you also have these workforce shortages that the health sector is really having trouble with right now, as well as overcrowding conditions when you have people seeking treatment, an influx of people seeking treatment. And I'm not going to spend too much time on solutions, but I did want to provide a couple of solutions and how we're thinking about this from a health perspective. And so this one approach is a health and all policies approach. And so since health is really connected to policy decisions, whether lack of policy or implementation of policy, we know that what the health community is pushing for is that policy change accounts for health in all aspects of decision making. And so what a health and all policies approach, it's a multidisciplinary approach that makes health and health equity central to policy discussions. And so this approach recognizes that many health challenges, such as climate change, are complex, and they are really connected to what we call the social determinants of health. And so this is where people are born, where they live, where they work, and the circumstances and systems in which are the systems that affect those circumstances. And so when we think about how lack of preparedness and climate risk are unique to specific communities, we can already start to understand where the system is failing people and what populations and communities are most impacted. And with that information, we can identify adaptation and resiliency actions for the communities that are most harmed. And then, as I mentioned, healthcare preparedness can be the difference between a hospital shutting down and a hospital staying operational during an event. And so there's a number of tools that health facilities are using to plan for climate-related risk. So one of them is assessing the vulnerability of their health system. Where are their backup generators? Where are their power sources? What happens? What climate risk are they going to be experiencing? And how are those critical services potentially impacted if they experience a wildfire and flood in the community? Hospitals can also develop plans to upgrade and invest in resilient infrastructure, and then develop preparedness plans to implement during extreme weather events. And there are many hospitals that are doing such things. However, there are a number that aren't, and we know that there's a huge gap that needs to be filled in terms of making sure that hospitals and healthcare facilities are adequately able to prepare to care for people during climate-related events. As health professionals, we're also engaging in discussions on just transition. I put up some examples or definitions from organizations that work with communities or professions that are really impacted from the transition from fossil fuels to clean energy. And Texas, this is a really important thing because many people's lives and livelihoods, their jobs, their communities are tied to fossil fuels. And we know that when transitions aren't managed well, we see significant community disruptions and health impacts that result from that. And the economic disruption can really have a huge impact on community cohesion, people's livelihoods, and people's mental health. And we know that happens when major industries leave communities without having a plan in place of how those people who are most impacted are going to be able to benefit from the clean energy transition. And so this is really important conversation to be having to ensure that people aren't left behind. And then lastly, it's critical that we are working across sectors and disciplines to really build enough power for change. And I know that many of you probably work with health professionals in the communities that you're serving, and many of the nurses that we work with are also part of faith communities and organizations, and so there's just kind of a natural collaboration that can happen when thinking about climate change and health. And we know that both health professionals and faith leaders are very trusted in their communities, and so we often are able to get different things across that perhaps a politician or someone else might not be able to really sway a community. And this is really important so that we can talk about these issues in a way that resonates with people, and so that we kind of overcome those obstacles to talking about climate change and as well as addressing climate change. And so I just want to thank you all for your attention, and I'd love to take some time, I think we have enough time, take some time for questions, as well as I'd love to hear, how you may be working with health folks in your community or how you're seeing health impacted, and if you have ideas for how we can increase collaboration across the different groups that we're working with. So thank you so much.
Right. Questions in the room, and Davey's going to share some to come in online as well. Questions?
First of all, I just want to thank you. It's great to have a nurse here. I think we all, over the last 2 years, have realized how completely unappreciated you guys have been, and I think that we're maybe getting some idea now of how wonderful your profession is and what dedicated people are in it.
Thank you.
Toward that end, could you talk a little bit just in general terms, since, like I said, since we have you here and you're in the front lines, what is the general status, or what are the nurses feeling these days? We're reading that they're leaving the profession in droves. Mm-hmm. They're overworked. They're tired of this. Could you just give us your thoughts about that and what we can do to make you feel more appreciated and what we should be doing to help your profession?
Yeah, I know that's a very good point, and that's something that is very concerning to even those that are staying within the profession, because even prior to COVID, there was a nursing shortage, especially with the increase in aging population. There's more and more people to care for, so that was already a concern. And then nurses are incredibly burnt out, particularly the ones who have been working in hospitals caring for COVID patients. And I would say I think nurses overwhelmingly feel pretty supported by the public. I think there's a lot that can be changed within hospital administration and healthcare facilities to increase appreciation of nurses. And I also know that there has been a lot of public health professionals, nurses who are just trying to share evidence-based information that have really come under fire for some of that because of the decisiveness in our country. And so I think the more and more that we can try to overcome some of those barriers in terms of thinking about COVID and really talking to people why vaccines are important, why we need to be doing public health protections, that can be incredibly helpful. But I think nurses are recognizing that the public is really valuing them, and I have to say we are consistently rated the most trusted profession, and so I think nurses feel that kind of support from the general public. I think there's probably a lot within a healthcare systems level that needs to change.
I am married to a nurse, so thank you for that. Also, since we're recognizing, are there any other nurses, medical professionals, retired nurses in the room? Would you stand real quick? I just think it's appropriate. All right, thank you. Other questions?
I've got one from the chat from Ruth. She is wondering if your organization connects with school nurse organizations.
Yes, we do. There is a National Association of School Nurses that we work with, and they are a really fabulous group of nurses because they're really within the community, within the schools, and their organization is doing trying to increase their work around environmental health. And so they're working a lot on climate change. I know within their leadership, they've made a commitment that climate change is an important issue for their organization to be working on. They also work on a number of environmental issues relating to indoor air quality in schools, or perhaps things that are happening within the home that are impacting the health of their students. So they're a very active group of nurses, and we do partner with them quite a bit.
Excellent. And Ruth herself is a retired RN, and school
fabulous.
health was her area of passion.
That's great to hear.
While I'm walking over here, hey Ruth, thank you.
So what is on your wish list for groups like United Methodist Women that are advocates and justice seekers? What do you want us to do?
That's a great question. Oh. I mean, I think within a state like Texas, there's a lot that can be done in terms of how trusted you all are within your communities. And so, to be able to talk about these, maybe you don't come out right and say climate change, but you talk about it in different ways that resonate with people, I think that can be incredibly impactful. I'm also happy to connect anyone who's interested in working with nurses. We have some nurses in Texas in different areas of the state, and I think that can be incredibly powerful in terms of if you all are working on specific policy or a specific activity within the community. I think that collaboration can be incredibly helpful because we know we need to be doing more together because it doesn't work when we are in silos.
Thank you for connecting the environment and our health together. It's really important. I was wondering if we should advocate or not, because certain parts of the states don't have public hospitals. Mm-hmm. And that is a really different, in South Texas we don't have any public hospitals. Is there, would that be something we should be advocating from our government to do, to help the profession? So what would work best?
That's a good question. I think if you can make healthcare is a right? And we need to decrease barriers to people accessing care. And so any way that you can advocate for someone being able to access more affordable care or being able to access a facility in their area, that is incredibly helpful. I also know that Texas has a lot of rural areas that perhaps someone who lives there has to travel a really long distance to healthcare facilities to get care. And so you can also advocate for increases in telehealth services and also broadband access for those areas, because someone can't access telehealth services if they can't get online. So I think there's a number of ways that we can overcome access to care issues. But then on the flip side, I think we focus a lot about healthcare systems and hospitals, and we don't necessarily focus on keeping people healthy in the community, because that's a huge number of reasons that people are actually, their health is impacted because of where they're living and working. And so I think if we can start to think about how we shift care to communities, we can help prevent things before people even come into hospitals.
Oh, you're back.
Thank you again. My daughter-in-law is a nurse, and I've watched her go through the process and how she's had to deal with the changes that have happened over the last 18 months or so. At lunch, we were talking about something, and we were talking about how one's livelihood, among other things, is affected by their zip code. And healthcare is one of those that is very much affected by your zip code. So what could we, you mentioned, and Cindy talked about South Texas and public hospitals. Of those hospitals that are currently in play, what can we do to work with the hospitals to spread out a little bit more, to provide a little bit more access, to be a little bit more creative for those individuals who are more than an hour away from the next medical professional? What are some things that we could potentially do with that?
Yeah, that's a great question. And I know perhaps it's not necessarily having a facility in an area, but there is some models that are utilizing community health workers who are actually embedded in communities. And so they're almost like an extension of healthcare facilities. But perhaps there isn't a hospital or health system in that area, and that's a model that can be advocated for. And I also think just even bringing, if you're living in an area where there's a big health system that you feel isn't serving the interests of the community, I think even approaching healthcare facilities, or even talking with some of the nurses or doctors or healthcare workers in that facility to see if you can just start conversations about what the biggest health issues are, and it's difficult with private hospitals because they don't have as many regulations that they need to adhere to. But even just talking about some of the major issues that the community is experiencing, and that can help open up the conversation a little bit.
I'm going to ask a question real quick, and then I'm going to turn it over to the nurse. But I wanted to ask, we're hearing more and more in environmental work about community science and community-led research. I would assume that there are ways that, from a health side, members of the community can work with nurses and other health professionals to do that kind of research to help move forward some of the issues that you've been talking about. Could you talk a little bit about that?
Yeah, and I would say probably the most natural partnerships that can form are with universities. Because they often have access to some grant funds that can do community projects. And so if there's a school of nursing at a university that is close to you, I think talking with faculty there and talking about how, what are the community needs, and then doing some of these citizen science programs. I know we have a colleague in Alabama who has, through her research grants, she's been working with a community called Uniontown, as well as other communities within Alabama that are located with pretty close proximity to coal ash landfills. And so they're having a number of health impacts from that. And what she was able to do with some of that grant funding, she was able to do water testing and soil testing with that community, and then do a little bit more around citizen science to help, because unfortunately we have to build the case. We can't just say that people are having all these reports of health issues. No, that's not how things work these days. So she was able to provide some support in what actually toxics were in people's water, so that they were able to take that to city council. It definitely is a challenge in Alabama, but she's continuing to do that work with other communities.
Yes, since we were talking about location, for the people who are impoverished and cannot move and are impacted by the ruling oil and gas industry in their communities, what kind of projects have you guys done that has actually helped increase the health of those people that cannot move?
Yeah, that's a great point. I would say we have many nurses who have worked with communities in Southwest Pennsylvania. That's just a hot spot for fracking, and for that state, since fracking is just so widespread, to immediately say we're going to work towards a ban on fracking, that's just not going to work because it's already embedded in the community. And so what they've been doing is they've been working, there's an organization called Southwest Environmental Health Project, and many of our nurses have been working with the community to do education around some of the health risks associated with fracking. They've also created a health registry so they can document what health impacts people are experiencing, and so they have that data to support, and then they're able to track and hopefully help prevent some of those exposures or provide people with education on how they can reduce exposures. So it ends up being a little bit more of those downstream interventions, unfortunately. But and I would also add on the flip side, there's some health professionals that are not as supportive of these issues either. For example, in that same community, we had people calling into the health department with their complaints, and the folks in the health department were actually just kind of throwing it under the rug, and it was actually found out a couple years later that people were calling about this. And so what our nurses actually did is once they learned about this happening at the health department, they were meeting with elected officials and trying to get some change within that, and they were successful with that. In Texas, yeah. So it's been much more challenging. We definitely had a nurse in Lubbock who was trying to work on, she was also working around oil and gas and fracking, and she unfortunately wasn't as successful because you hit so many barriers. And so I think it's as much as you can doing work around preventing people's exposure. So it's already pervasive in the community. You can continue to advocate, but what you can probably do most effectively is to help figure out where people are being exposed in terms of air and water quality and see if you can help institute some interventions in that way so that you can prevent exposures. I know it's different in different areas of the country, and it's not as easy in some places, and Texas is one of them. And I commend you all for your work, because I know you all are running into so many obstacles and continuing to fight. So thank you all.
Yeah, thank you. What a great presentation, right?
For the sake